Hi, this is Jesse Davey with Universal Hospital Services. Today we'll be reviewing the OnCare Harmony Low Bed. The OnCare Harmony Bed is a best-in-class low bed that's designed to meet the standard of care in the acute care market. The Harmony Low Bed has a weight capacity of 400 pounds and a sleep deck that measures 35 inches wide by 80 inches long and expandable to 88. What sets the OnCare Harmony Low Bed apart is its 9 7/8 inch ultra-low deck height and feature-rich design, which when combined help reduce the frequency and resulting injury of patient falls. Now let's take a closer look at these features. The headboard can be easily removed for access to the patient. The headboard, footboard, and side rails are all embedded with antimicrobial granules to help prohibit the growth of allergens and bacteria. The head of the bed includes a 37-pin connector and 1/4 inch jack that can be integrated with the head wall, operating the nurse call system and the bed exit alarm. A collapsible and height adjustable IV pull is also incorporated into the bed frame. Now let's take a look at the caregiver side rail controls. We'll raise the bed up to a more comfortable working height by pressing the bed up button. The caregiver side rail controls include head up and down, bed up and down, and foot up and down. Each of these functions can be locked independently by pressing the lock button. To unlock, simply press the lock button again. Pressing and holding the chair button will raise the head and catch the knee, then bring the bed into a reverse Trendelenburg to get the patient into an upright seated position. When the contour button is engaged, the head and knee catch sections will move at the same time when either the head or knee catch button is pressed. The level all button brings the head and knee catch sections back down to a flat bed deck. The electronic brake, which you can hear, provides a positive lock to each of the 4 casters, and the electronic steer locks one of the foot casters into a straight position to navigate more easily down hallways. Also featured on the side rail is the electronic head of bed angle indicator, which allows for the caregiver to easily see the angle at which the patient is seated. For the patient controls, we have a head up and down, foot up and down, and nurse call button, and an integrated USB port for patient use of personal electronics. Although the bed is equipped with an electronic CPR release at the footboard control panel, the manual release is located here between the head and foot side rails. Simply pull outward on the handle and the head section will return to a completely flat position. The easy-to-use side rails have 3 different positions. It's in the upright position now. Press the green release button to lower to a mid-range position for easier egress. Press again to lower all the way down. We know that caregivers don't always have both hands free, so the side rail release levers were designed to be controlled by your knee as well. The side rails, when at their midpoints, offer left and right handholds for safe patient egress. To engage the foot extension, locate the black knob underneath the bed frame. Pull the knob out and rotate counterclockwise. Repeat on the other side. Then pull out on the foot end of the bed until it locks into place. Be sure to add mattress deck and foam mattress extensions. The footboard control panel has all the same features as the caregiver side rail controls, with the addition of the underbed light, the electronic CPR release, Trendelenburg, and reverse Trendelenburg controls. The underbed light allows the patient to see their environment when exiting the bed. As mentioned earlier, the bed deck controls can be locked independently or by pressing any of the 2 lock buttons simultaneously. You can lock and unlock all movement controls on the footboard and side rails. On the left-hand side of the control panel, you'll see the integrated patient scale as well as the bed exit alarm. Press any button to engage the patient scale. Make sure to prepare the bed with all pillows, linens, accessories. When ready, press the 0 button and release when the countdown begins. Once the bed is zeroed, you're ready to put the patient in the bed. Once the patient is in bed and is settled, the bed will record their weight and position. This is indicated by a chevron or upside down V displayed in the upper right-hand side of the display screen. Weight can be measured in pounds or kilograms. To change the weight setting, press the Enter button. Scroll to pounds or kilograms and press Enter and make the desired selection. With the chevron visible, you can set the bed exit alarm. To engage, press the Set button and then adjust to the appropriate sensitivity. Zone 1, the most sensitive, will alarm when 5 kilograms of the patient weight is shifted in the bed. Zone 2 will alarm when 5% of the patient's weight is removed from the bed, and Zone 3 alarms when 45% of the patient's weight is removed from the bed. To deactivate all zone alarms, press the Set button until none of the zones are illuminated. The alarm volume can be adjusted between low, medium, and high. Before leaving the patient, ensure that the appropriate zone and volume are selected and that the chevron is visible. The Alarm Mute button will temporarily disable the bed exit alarm. After 10 minutes, the mute function will automatically reset, returning the bed exit alarm to the previous setting. Below the control panel, you'll see an integrated pump holder and an accessory outlet for air mattress control module or other medical devices. And like the headboard, the footboard can also be easily removed. In the rare instance you would need to manually override the electronic braking system, simply grasp, pull, and turn the manual brake release handles located at the foot and head end of the bed, and both brakes will be released. When the brake button is illuminated red, the brake is set. When the brake is flashing white, it is not set. The OnCare Harmony Low Bed is equipped with a unique triple guard anti-entrapment system. The 3 features of the entrapment system include optical sensors underneath the bed, pressure sensing panels along the caster plates at the head and foot end of the bed, and load cells housed within the bed frame. If any one of these safety features detects an obstruction while the bed is lowering, the bed will automatically stop and raise up again, freeing the obstruction. Accessories for the Harmony Low Bed include a hand pennant with patient controls for head up and down, foot up and down, and nurse call. An overhead trapeze is available to allow patients to help mobilize themselves. In summary, the OnCare Harmony Low Bed's feature-rich design includes an ultra-low deck height of under 10 inches, antimicrobial surfaces, electronic brake and steer, an integrated patient scale, and a triple guard anti-entrapment system. These features combine to create a best-in-class low bed that meets the standard of care in the acute care environment.